Welcome to Sounding Board. This is a weekly program completely produced and directed by club members of Seroptimist International of Novato. The mission of the organization is to help improve the lives of women and girls, both locally and globally. We try to keep that mission in mind as we plan our programs for Sounding Board. Today's program will focus on MS, multiple sclerosis, and nutrition. I always have a difficulty with that word. I can see why they call it MS. MS and nutrition. But you know what? Health and nutrition are always high on the list of women. So we think we're spot on with today's program. One of our members, our club members, Vicki Campbell, right here in Novato, has MS. And she has the passion to help educate people about MS. She put together this program, and because of that, she became acquainted with Dr. Elizabeth Campbell and brought her here as our guest today. So, Dr. Crabtree, we're very happy to have you here.
Thanks for having me.
So, let's start right at the very beginning. What is MS? What are some of the symptoms that a person might have?
So, as you mentioned, the letters MS stand for multiple sclerosis. And that first word, multiple, tells you that clinically, a person has more than one symptom. MS is an autoimmune condition, so typically our immune system should be protecting us from non-self, whether that's an infection with a bacteria or virus, or even your own cells that are behaving aberrantly. Your immune system actually keeps that in check as well. That's considered non-self, and it's the surveillance system for cancer as well. Unfortunately, in a few situations, the immune system is misguided or misfires, and instead of attacking a bacteria or virus, it attacks part of our own bodies. So, for instance, lupus, that a lot of people are familiar with.
Oh, yes.
Lupus, the target is double-stranded DNA, and therefore that person
Is that a form of MS?
It isn't, but it's in the same category as an autoimmune condition. In lupus, because double-stranded DNA is affected, people can have liver symptoms and kidney symptoms and skin. MS is much more specific. The target there is in the central nervous system. So the organs affected are the brain, the spinal cord, and the optic nerves.
Okay, well, Dr. Crabtree, you're by trade a medical doctor.
Yes.
So what drew you to this whole field of MS and specifically with nutrition and MS?
Well, as we were talking about earlier, in my undergraduate training, I was very interested in the neurosciences, and my absolute favorite class was my psychopharmacology class. So when I entered medical school, although I was open to the idea of, say, pediatrics or OB-GYN, I found myself naturally gravitating to neurology. And I don't know if you've seen Harry Potter or you're forced to watch it, but I often say that similar to Harry Potter, where the wizard doesn't choose the wand chooses the wizard, I feel the same way about neurology. It taps some of us on the shoulder.
Interesting. Very good. Well, I'm sure Vicki's happy to know you. You're a special person to her. So what's the role of nutrition with MS? You feel pretty strong about that whole issue.
I do. Well, personally, I think that most things in life, any health condition, really any problem a person is having, is probably best addressed in a multidisciplinary fashion. So the idea of a magic bullet or a magic pill, I think, is a rather outdated and narrow view of how to approach health.
Good.
So personally,
I agree with you there.
Good, yeah. So I really feel strongly that exercise, stress reduction, and nutrition should be a part of a responsible, comprehensive plan to take care of our patients with multiple sclerosis.
So what's that whole role of nutrition in MS, and why does it even matter?
Yeah, great question. So I think it matters on a few levels. Firstly, it's something that a patient or person can engage in or engage with, and so I think it's empowering for that person to take control of something that they can control. Secondly, there's some direct evidence and indirect evidence that what we eat can affect our risk for MS, the severity of our MS, and even some specific symptoms in MS. And lastly, as you mentioned, health and nutrition go hand in hand in so many spheres outside of neurology and outside of multiple sclerosis.
Well, tell us about the information regarding, diet.
Yeah.
And how does it play in the field?
Right. It's actually a little frustrating. As someone, I practice at the UCSF Multiple Sclerosis Center. We have 13 MS specialists, and each person has an arena in which he or she specializes. My focus is on clinical care. In an academic setting, most people base their recommendations on what's called randomized controlled data.
Right.
So published literature, peer-reviewed literature that isn't just observational, but rather a planned research study where there's a control arm or placebo arm, and then your experimental arm, whether that's looking at gluten or dairy or anything else. If you go on our search engine and look up multiple sclerosis and diet and do your filter for randomized controlled data, over the last 20 years you will uncover 4 to 6 references.
Oh dear.
So it's a little frustrating. I think that I think the academic physicians in our defense like to use evidence-based medicine, but I like to approach this with a broader approach. Where can we get information so we can guide our patients regarding nutrition?
So it's is it a money issue behind the scenes with getting things funded?
Well, we don't want to get too deeply into politics. Let's just say that funding for research can come from the NIH, highly competitive. It can come from pharma, and those grants are not as directly applicable to nutritional studies.
Now, a lot of us here in Nevada are familiar with the Buck Institute up the way, and they do a lot of collaborative scientific research, and they lean on each other to sort of find out, wait, what's going on over in your lab, and what can we get? And what are some of the other autoimmune conditions that might be seen in other diseases that you might be able to pick up on things?
Right. So I think that gluten, so we think of it as a gluten allergy, but it's actually that the gluten induces an autoimmune condition. And so that's a perfect example. Sometimes that's called celiac disease. That's a perfect example of a condition that can be treated completely by dietary modification. So firstly, I think that other health conditions reinforce the concept of improving health through dietary interventions. So other examples would be diabetes, hypertension, high cholesterol, and then interestingly, there are even specific diets for certain medications. So if a person's on the blood thinner called Coumadin, that person counterintuitively shouldn't eat leafy greens because the vitamin K cancels out the blood thinner. So I think other diseases give us, reinforce the idea of nutrition and health.
Okay. Has there been more research maybe that's been done in these other fields, such as psoriasis or Alzheimer's or something like that, Parkinson's, that may have given you some more evidence?
Yeah, well, initially when we were talking about developing the content for this, I was hoping and trying to think creatively about where else could we look for information, and there isn't a whole lot in those other arenas. However, in MS, there is the direct evidence that we have regarding a few things like vitamin D, omega-3s, and polyunsaturated fatty acids in place of saturated fats. So we do have some direct evidence.
Good.
And then we have some epidemiologic information, and of course the feedback that we get from our patients.
You were talking once when we preparing for this a couple of weeks ago, I think it was now, but you were talking about the studies that are available, the ones you just mentioned, and you said that there was an operative window, and I found that fascinating. Can you sort of let us know a little bit about that?
I find it fascinating too. So the observational studies, or what we call epidemiologic studies in MS, in multiple sclerosis, and vitamin D, are highly convergent. In other words, they show the same thing whether we look in pediatric MS or if we look at large cohorts of patients, large groups of patients in different countries, whether it's Australia or Canada. we see that people with low vitamin D are at a higher risk for MS, and people with higher vitamin D are at a lower risk. And in fact, in the pediatric population, low vitamin D also sometimes predicts a more severe course. So you can imagine that we now check the vitamin D level and supplement vitamin D. This is where operative window comes in. When you're observing adults, you really don't know when the vitamin D was important. Was it important in utero? Was it important at birth? Was it important at puberty? Right? And so although we're supplementing now, maybe we missed that operative window.
Yeah, interesting.
In my opinion, we now know that vitamin D can be anti-inflammatory, it can change the immune profile, and if nothing else, it's helping with bone health.
Good, good. Where do you stand, Dr. Crabtree, on research and the advice you give your patients? I know you sort of have expressed you have sort of torn feelings sometimes.
Right. Well, like I said, it can be frustrating that we don't have enough clean evidence-based medicine. That gives us a few things that we can recommend. But there are other avenues by which we can learn about nutrition and multiple sclerosis. As I mentioned, there are general health concepts that I think apply to our patients. There are concepts that are specific to certain symptoms and other settings that likely apply to our patients. And these ideas, the ideas that we'll talk about in a minute, aren't specifically mine. I'm standing on the shoulders of others. I think that the difference in perspective that I bring to the table is that I work with a lot of patients. I have over 1,000 patients with multiple sclerosis, and I'm a good listener. And so I learn from my patients every day, and I think that's a major source of information, is the feedback that our patients give us.
Good, good. So you've been working along with that. You've been working closely with a support group at UCSF. So tell us about that.
Sure. So our support group, similar to the one that Vicki Campbell is involved with, is a fantastic group of people. I created it close to 6 years ago, and it's really turned into almost a family environment, similar to the Marin group, actually, another great support group. We meet on the third Thursday of the month. It's from 6 to 8. Food is provided, and I've recently changed the menu.
Gluten-free?
Changed the menu and the venue. Our clinic has moved to Mission Bay. But the project that I'm excited about is I've partnered with someone in the community named Adina Nimero. She's someone who's trained in nutrition and foods that heal. She's written some books, and she and I have created a program for the support group to pilot. It's a 12-month program where we're going to do 2 cycles, breakfast, lunch, dinner, and 2 snacks. Adina is going to prepare the recipes in little samples for the patients and provide a recipe card. And each month we'll highlight a different dietary concept in MS, whether it's gluten-free, dairy-free, low-fat, omega-3s, magnesium, etc.
You could come close to doing serious research with that.
Well, we might.
Yeah. Have you done any writing on all these concepts that you're finding and things?
I wouldn't say that I've written in the peer review literature. I've done more patient education and physician education regarding the subject. But as we move forward and get more information, I surely hope I can contribute.
So as you're gathering this information and listening so carefully to your patients, what are you seeing? What are you hearing?
Yeah. So I think the most consistent positive feedback I get is regarding limiting dairy and limiting gluten. So often we'll do a blood test to see if someone is allergic to gluten. And even if those studies are negative, often people feel as though they have more energy, or their fatigue improves, cognition improves. Similar situation with dairy. Excuse me. Other things that have become some old concepts, such as having more lean proteins rather than saturated fats. Really, Dr. Swang proposed his diets long ago. Patients, I think, enjoy that avenue, but I get less specific feedback about it. Lastly, the fruits and vegetables. When people increase their servings and eat more meals during the day, it often improves things such as bowel function, bladder function, and energy, as well as complexion.
Oh, good. So you said something also that about diets need to be individualized.
Yes, yes. So MS is highly variable, and if we get a chance to get Vicki's input, and I'm sure she would agree. So MS is variable in terms of what causes it, what clinical course the person follows, what symptoms the person has, who responds to which medications, who gets side effects. So in that world of variability, I think it's highly unlikely that there's one MS diet. I like the idea that different people probably will resonate physiologically with different dietary interventions, and in the absence of true allergies, I work with my patients keeping food journals and altering one thing at a time.
Good. So if they were keeping a food journal, what would it look like?
So the food journal can be, it's basically, let's say the first intervention is limiting dairy. That person might chart his or her MS symptoms, general symptoms.
Is it just an open-ended kind of diary, or do they actually have little charts and little things to do?
People do it differently. We haven't created a standardized food diary or food journal for this situation, but it's actually a great idea. We should probably, I think it would be a good tool for the patients. At this point, I've been working with patients, again, individually. Some people like columns, some people like paragraphs.
Yeah, that's true. I like Excel spreadsheets myself. I did a whole food analysis for myself one time, and I did it on an Excel spreadsheet, and I just plotted it all out and added it all up, and which things affected me in different ways.
Yeah,
it was really interesting when you take time to analyze what's going on and share it with your doctor or whatever. It makes them pretty impressed that you pay attention to yourself.
Absolutely.
Yeah, I think so. So what did, and something else I was going to mention, up at the Buck Institute, they were talking about that it's not too long from now, they think, that we'll all have maybe little embedded chips where we will have an individual, in fact I even read about it in the paper the other day, individual, it'll analyze our blood and develop then a way for us to have individual individual responses to medicine and things like that. So,
well, it's interesting you bring that up. One of the most recent publications potentially regarding diet and MS was a study done with mice. There's a mouse model of multiple sclerosis called EAE, or you don't want to know, but experimental autoimmune encephalomyelitis, EAE.
Ooh, another big word for me.
And they looked at diet for the mice, high salt versus low salt, and the mice with the high salt diet had more severe mousy MS or EAE, and some of the blood markers that we look at that we think represent inflammation, those were much more elevated in the mice who received high salt in the diet. And we were talking about the regulation of that within the bloodstream, and would there be a way to measure it. And
science is, and medicine is going to be really interesting in the next 10 or 15 years. Just really look forward to it. What advice do you have about gluten and dairy restricted diets? What advice do you give your patients?
Yeah, well, what I find is that my patients aren't universally interested in diet, and it's certainly with a new diagnosis patient, it's too much information to immediately launch into dietary recommendations. But after a few visits, if a person is interested in dietary interventions, we will sequentially limit things. Of course, as I mentioned before, we would do blood tests first, because if the person is allergic to gluten, we cut it out of the diet. But if the person isn't allergic, then again, we sequentially limit dairy or gluten.
Interesting. Okay. And I think you were saying that it's important for patients, even though they're extremely motivated, to have reasonable expectations. And I thought that was a real important point that maybe we might want to leave with our audience today.
I think that's, I'm so glad you brought that up, because there may be specific instances where a diet alone could take away all MS symptoms. There may be some patients like that. But most patients, I think, will either feel healthier in general, but maybe not notice a difference in their MS, or they may notice an improvement in general symptoms, such as fatigue, sleep, mood, or they may have an improvement in some of the more specific symptoms or focal symptoms like numbness or weakness, tightness of the muscles, or blurry vision. But in general, I think that patients could anticipate feeling better or an improvement, but it's important that we don't set out hoping that it's going to take everything away. It's always, it would be a nice bonus, but I think that, again, a multidisciplinary approach tends to be the most responsible way to approach things.
Now, Vicki Campbell, I mentioned her earlier. She's one of our club members, has MS, and she's worked with you, and seems to have a really good reaction to watching her diet. Can you talk about that a little bit? I asked her ahead of time. She said it was okay if we talked about her.
Well, sure. Should we have Vicki chime in? Or
she's hiding over there in the corner.
Vicki is one of my patients who's highly motivated, and I like that she's very honest about that. When I said, are you gluten-free? She said, well, I limit gluten, and she's very knowledgeable about gluten-free pasta, apparently, but she feels free having, say, a bran muffin that has gluten in it. So I think Vicki's done a good job of finding that balance of limiting things, but maybe not completely denying herself. And in general, I think she feels as though she does better in terms of her energy and otherwise when she's paying attention to what she's eating.
Good. Well, I know she speaks highly of you, so you must have motivated her, and she feels pretty good about what she's doing. So what are the typical symptoms of celiac or reaction to gluten specifically? We're talking about gluten now.
Well, you know what's interesting is that historically we thought of celiac disease as a gastrointestinal disorder. And so people weren't even suspected of celiac unless they came to the doctor complaining of bloating, diarrhea, abdominal pain, abnormal bowel movements. Before we had the blood test, celiac was really a diagnosis done by biopsy. So people wouldn't know to biopsy the gastrointestinal tract unless that patient was having symptoms there. Now that we have a blood test, it turns out that in addition to those typical abdominal or GI symptoms I just mentioned, people can have an absence of the abdominal symptoms and only have nervous system issues or even skin rashes. So we're now learning that gluten sensitivity is more than just a gut disorder. Now, most GI specialists will tell you that even if you're someone who your gluten sensitivity, you only get a confluent, a full rash, say, on your back. If we looked and did a biopsy, we would see changes in your GI tract. So, so we've gone from celiac to celiac and non-celiac. In other words, there isn't GI involvement, to now really non-celiac is considered pre-celiac. So eventually that person will have gastrointestinal issues if he or she doesn't limit gluten.
That's interesting because there's so much talk now of gluten, and and the commercial products that have come out, all of a sudden now are saying gluten-free, and they just really picked up on that so quickly.
Well, and even just in the last 5 years, it went from a small section in Whole Foods to now Safeway has a whole gluten-free section. So
it's amazing.
It's much easier to go gluten-free now than it was even 5 years ago.
So what are some of the issues with symptom management?
This is another concept that I think is interesting because remember we talked about the two different broadly the two categories of MS. So relapsing MS is thought to be more inflammatory, whereas progressive MS is thought to be more degenerative. And so in those broad categories, there may be specific dietary approaches. It's the same thing with symptoms, and so you can see that we're heading towards a highly individualized diet for each patient based on disease type, body habitus, and symptoms. So two symptoms that can be approached with diet are muscle spasms or muscle tightness with magnesium and potassium, and then of course bowel symptoms by increasing the amount of fiber and roughage that's taken. And the bowel symptoms are often accompanied by bladder symptoms with my patients. So really, by improving bowel function, my patients can also improve bladder function, which is exciting.
We've talked about an awful lot today. So if you were to sort of summarize or think about some key concepts that you'd like to leave with the viewing audience, what might they be?
I would say firstly that MS is so variable that it's unlikely there's one diet fits all. Number two, there are many avenues by which we can learn about nutrition in addition to evidence-based medicine, and you and I have talked about some of those. Number three, if you have MS, I would recommend getting your vitamin D level checked and supplementing appropriately. We have evidence to support using omega-3s, and a person can check with his or her physician to make sure it's safe. And so I would recommend those two things. Number four, if there are any physicians watching, I want to encourage them to listen to their patients. Because we learn from our patients every day. We're done with the what's called paternalistic medicine, where we just project. It's I really consider it collaborative medicine, and so work with patients, tailor a diet for each of your patients if you have the time.
And I think the other thing, one more thing to add to your list, if I may, would be about realistic expectations.
Yes.
The enthusiasm is wonderful, but you know, we don't want to let ourselves down too much. You know, we need to be realistic, and like you say, maybe you know that window. I thought that was very interesting. Maybe we missed that window, and you know.
Right, but again, if we miss the window with vitamin D, that does not mean you won't feel better by supplementing vitamin D. And I guess I didn't stress that for our patients who have very low vitamin D, they almost universally feel better once we get their levels up in terms of cognition and energy level.
You've been a fabulous guest.
Oh, thank you. I really enjoyed coming.
Thank you so much. Yeah, this has been great. So thank you, Dr. Elizabeth Crabtree. And thank you, all the crew members, the people behind the scenes who are our Seroptimus Club members, and especially thanks to Vicki Campbell, who was the one who produced and brought to us Dr. Crabtree. I had the Crabtree there. I've had a problem with that. And thank you, Rick Tucker and Leon Johnson with Novato Public Access Television. And thank you, most of all, our viewing audience.